Hi guys, we're Team 3 and we'll be covering Chapter 3 on the pharmacist and the pharmacy profession. I am Jessica Stallman.
I'm Matt Calamita.
I'm Nate Damon.
Christoph Kofi.
Becky Hildebrand. Nikki Daska.
Suppose you have just completed your educational degree requirements and earned your PharmD degree a few weeks ago. You are currently working 8 hours per day at WeCare Pharmacy to fill your internship requirements, and your appointment to take the board exam is next week and quickly approaching. You have your head buried in books and notes one Wednesday evening when suddenly it hits you.
Gosh, if I pass the NAPLEX and jurisprudence examinations, I'll be a registered pharmacist before the end of the next month.
That weekend, you make the trip back home to visit your family for the first time since moving 5 hours away to take the job at WeCare. Your mom lovingly fires a series of questions your way. Well, what's it like to be a pharmacist? Is it what you thought it would be? Have you met any other pharmacists? How do they treat you at your new job? What do you do there anyway? You begin to reply to your mom, one question at a time, then become puzzled that you are not exactly sure how to answer her. In fact, you had not really thought about these things, so you begin to think, what is pharmacy all about anyway? Pharmacy is a quickly growing science in the medical field that involves knowledge and technique to dispense medications. There are a lot of misconceptions about pharmacists and the pharmacy profession. Generally, you see a pharmacist take a bottle of pills, dump some out, put them in a new bottle, but it is so much more than that. Pharmacists are responsible for the provision of drug therapy for the purpose of achieving definite outcomes that improve a patient's quality of life. These outcomes include the cure of a disease, elimination or reduction of a patient's symptoms, arresting or slowing of a disease process, or the prevention of a disease or symptoms, according to the book Hepler and Strand. Pharmacists may analyze a patient's allergies, conditions, and overall profile to make sure the prescribed medications are suitable. They may administer immunizations, educate patients on prescriptions, interact with other healthcare providers and insurance companies, monitor compliance, compound medication, manage technicians or other staff in the department itself, and much more as the profession is continuously evolving. There are many fields and many opportunities within the profession, but they all share a common goal, a healthy world.
Do you have a pharmacist mentality, or does such a thing exist? The pharmacist mentality is an evolving idea that has been frequently changing along with the profession. Up until the 21st century, the mentality of pharmacists has been drug use control. Drug use control was defined by Brody in 1967 as that system of knowledge, understanding, judgments, procedures, skills, controls, and ethics that assures optimal safety in the distribution and use of medication. Brody's concept was useful for his time, but focuses mostly on producing and dispensing medications. In 1987, Hepler noted that pharmacists were overeducated and underutilized. His recognition of pharmacists' expanding education sparked a new era for pharmacy. In the 21st century, the idea of pharmaceutical care became the mantra of the pharmacist. This new concept expanded on the old mentality of producing and dispensing safely. Hepler and Strand define it as the responsible provision of drug therapy for the purpose of achieving definite outcomes that improve a patient's quality of life. These outcomes are 1. Cure of a disease. 2. Elimination or reduction of a patient's symptomology. 3. Arresting or slowing of a disease process. Or 4. Preventing a disease or symptomology. This new mentality encompasses the ideals of drug use control and expands the new mentality to include a more patient-centered focus. The overall concept for a pharmacist mentality needs to be a focus on flexibility and possess the ability to accept change and move the profession of pharmacy into the future.
We have recently looked into not only the current profession of pharmacy, but the history and evolution of the practice. We've looked into a shift in training from the initial guilds with master and apprentice pharmacists to the bachelor's degree into the current PharmD program. I think that this shows that this is a profession which is constantly evolving to adapt to changes in societal view and technological advances. Additionally, I have always valued community service, which pharmacists are in a unique position to perform. Pharmacists are able to work closely with other professionals in order to promote the best treatment for their patients. This is especially apparent with the new changes to pharmacists' role, with the increased focus on a patient-centered approach to treatment rather than the old ways of simply dispensing medication. For these reasons, I truly believe pharmacy is a profession for me.
How do you meet other pharmacists in the area? In any career or profession, it is critical to branch out and meet people that are in the same area of expertise. Pharmacy is just like any other, and there are countless organizations that allow for interaction and collaboration. In 1852, the American Pharmaceutical Association was founded to establish national standards of quality for drugs and chemicals in response to physicians threatening to regulate the profession. After the first organization was formed, several other professional associations started to develop and still do to this day. Each and every one of these organizations strive to provide specific benefits and services for those that use them. These include information dissemination, maintenance of practitioners' competency, career planning assistance, financial benefits, and participation in governance. All of these benefits and services help pharmacists in the professions and through the organizations they branch out and meet other pharmacists in the process. The most well-known professional organization is the American Pharmacists Association, which had its name changed from the American Pharmaceutical Association. This organization is the most diverse and serves pharmacists in all settings while being actively involved in the lobbying of the government for pharmacists as a whole. With it comes its student organization, the Academy of Student Pharmacists, which brings together more students than any other professional association. There are also organizations with corporate membership, like the Healthcare Distribution Management Association, where the goal is to strengthen relations between wholesalers, the suppliers, the customers, and sponsoring new innovations of technology and management practices for wholesalers. Last but not least, educational and regulatory organizations provide services to pharmacists with the addition of regulating their practice and educational requirements. The Accreditation Council for Pharmacy Education is one such organization that provides for the accreditation of professional degree programs. The board from this organization includes members from many other organizations, including the AACP, APHA, NABP, and American Council of Education. With all these organizations that have been created and implemented, finding and meeting other pharmacists in the area should be very easy and beneficial for one's profession.
You may find yourself wondering, how do you stay up to date of what is going on in the worlds of pharmacy and healthcare? Just as joining a professional pharmacy organization helps pharmacists to meet other pharmacists, it also helps them stay up to date in the world of pharmacy and healthcare. Serving the interest of their members is the reason why these organizations exist. Professional pharmacy organizations offer a large number of benefits and services. According to McCarthy, these benefits include distributing of information. By publishing journals and newsletters that have the results of pertinent studies, they also give updates on professional practices and legal issues. Some organizations are sending out weekly emails to update their members on current events, providing competency maintenance to practitioners by setting a code of ethics and standards of practice, and also providing continuing education. This is very helpful for pharmacists because they need to be lifetime learners and stay up to date with what is going on in healthcare. They offer career planning assistance by providing for jobs in related fields, as well as financing workshops for career advancement. They also have financial benefits for its members, which offer discounts and insurance. Professional Pharmacy Organization also gives its members the opportunity to participate in governance. Another great way for pharmacists to stay up to date is to network and reach out to their colleagues.
And lastly, what do you need to know and do to be the best pharmacist you can be? In order to be a pharmacist, we obviously must complete the necessary 6-year PharmD program and pass the NAPLEX. However, this does not make one the best pharmacist they can possibly be. Pharmacy now is so much more than just giving a certain amount of a certain drug to a certain patient. Each patient has their own unique case, and as a pharmacist, we have to be able to adapt to them, given their scenario and knowledge, or even be able to get past a language barrier. As pharmacy is becoming more patient-driven, we must also have empathy for our patients. Most of the time, we probably haven't been in the exact situation, but we need to be able to relate to it and to help our patients get well again. We need to advocate for them and the community in order to be well respected and further the field that ultimately helps us all in living healthier lives when otherwise we might not be in the best condition medically. However, in order to become the best pharmacist we could be, it would greatly help by being involved in the community around you. Of course, one should find a pharmacy-related organization that they like and become an active member, but we should also be involved in other aspects of the community as well. It would help us in meeting new people outside of our field and allow us to be well-rounded as we wouldn't be so confined to our niche we know so well.
Team 3 challenges you to answer these questions for yourself.